Hello, Namaste. I welcome you all to the 108th session of Gurubodha. In this session, we have, on behalf of all of us students, I cordially welcome Dr. Gururaja sir to this session. Good evening and namaste. I also cordially welcome Dr. Raghuram sir to this session. Good evening and namaste sir. And despite her busy schedule, we have with us Dr. Ashisha Rawat. Good evening and welcome and namaste. So this session is brought to you by easyayurveda.com. I dedicate this and all of my works at the holy feet of Dr. A. Chandrasekhar Udupat. Dr. Gururaja sir runs Dhavala Pentacare Ayurveda Center in Shumaga. To consult him or to get his guidance, please visit easyayurveda.com/Gururaja. He is an Ayurveda, senior Ayurveda doctor, and these are the few cases that he has treated. He is my Ayurvedic teacher in my graduation days and principal as well. Dr. Raghuram sir is Chief Content Officer of easyayurveda.com. To consult him or to get his guidance, please visit easyayurveda.com/Raghuram. And Dr. Ashisha Rawat is director of Ananda Ayurveda Academy in Illinois, USA, and is also a very busy Ayurveda practitioner. So with that introduction, let's dive deep into the topics for today. So this month is being celebrated as practiced as Constipation Month, our month for constipation. So we have collected a few questions regarding that. To begin with, Dr. Raghuram sir, please break it down what constipation means in Ayurveda, and is there any sub-classification like constipation arising due to Vata origin or Pitta causation and Kapha and Sanipatika and so on?
Yeah, thank you, Dr. Hebar. So I'll just present a few points from the perspective of Ayurveda. First of all, as Dr. Hebar said, this month December is recognized as Constipation Awareness Month. So this is to create awareness among the people. Awareness is there because constipation is such a problem which doesn't sit silent. So it keeps on alerting the person that you have some food in your gut going on, so the lower part of the gut. So person cannot be as much relaxed when he or she has constipation. So there are a few types of constipations, like it can be an occasional visitor. Here and there we can have constipation episodes in our lives. It may not be very regular. In such conditions, people know how to manage those things with some small home remedies, maybe some medicines which were prescribed already by the physician to take as and when the constipation occurs. Constipation also can have a very difficult phase. It can be a part of a big problem in its backdrop. So like it can be secondary as well. So it can be stubborn, it can be chronic, it can be acute. So it can be occasional. Constipation comes in different forms. So we know what constipation is. Touching constipation from the Ayurveda perspective, there is no one word particularly, as the question was asked, Vibandha. Vibandha is one of the words which we use, which means to get constipated or to get held up. Something is held up in the system. So mainly the feces, that we call it as the Vibandha. So we don't have a coined term for constipation, but the constipation mechanism of constipation has been explained through different words in different instances, in different references. Like we have a word called as Vitsanga. Vitsanga is obstruction. Sangha is obstruction of the feces, Vitsanga. So in that particular context, we can consider it as constipation. Vitsanga is a word used in the context of the Purva Rupa of Atisara. So here we have two strange diseases, like we have diarrhea, Atisara. Just before the manifestation of Atisara, there is constipation as the Purva Rupa. So these are the two totally contrasting conditions of the gut. So diarrhea, before diarrhea, so there is constipation, or Vitsanga as Purva Rupa. So this is an interesting point here. Another word which is frequently used is Koshtabadhata. Koshtabadhata, or Krura Koshta also we can call it as. Krura Koshta is like the behavior of the gut is very, very hard and difficult, and the gut finds it very difficult to throw away the feces or to cleanse the colon. So the natural cleansing mechanism of the colon has been disturbed or deteriorated here. So that is basically a contribution of Vata. So or the Vata predominant people, Vata constitution or Vata Prakriti people may have Pureeshaja. So it is very important responsibility for them to manage and maintain their bowel habits and to take control of Vata. So we will touch upon that point. Vata is the main culprit in the causation of Vibandha, as somebody has suggested that name. So Vitsanga and Kostabadhata, I even mentioned. So one more term which is used is Pureeshaja Anaha. In the context of Anaha, there is Amaja Anaha and Pureeshaja Anaha. So here, Pureeshaja Anaha. So Anaha, Admana, Atopa. These are the three words which are used very frequently in Ayurveda. We need to break and differentiate them. So probably this would be a suggestion to Hebar sir, like it may be a topic for the next discussion sometime. Admana, Atopa, and Anaha and Udavarata. All these are related conditions. Admana is predominantly, again, all these have association of Vata. Admana has a distension of abdomen, maybe with or without constipation. Anaha is caused by, so it's like a flatulence condition. It is caused by either Purisha or Ama in that sense. And then Atopa is a condition which may still have constipation, but predominant presenting feature is the gurgling sounds in the abdomen. Udavarata is a condition. Yes, Pureeshaja Udavarata is another term for constipation. Pureeshaja Udavarata. We're all obsessed with our works, especially during the computer age. We spend a lot of time on the computers, laptops, smartphones, and we are not smart enough to address the natural urges which are coming from the body, the natural signals, the reflexes of the body. Please address these things. So there are so many types of vegas or urges mentioned by Ayurveda, among which is Pureeshaja Udavarata. So that is Purisha Vega Dharana. So forcibly withholding the reflexes or the urge for defecation. When we do this on regular basis, we are reverse training. So what is the colon or the rectum and the anus trained for? They're basically trained to evacuate things. As and when there is a pressure, they just push it out and cleanse themselves. So this keeps not only the colon, but also the entire body happy and healthy. Even this doesn't occur, it leads to serious problems. So when we start holding the defecation reflex or the urge to defecate or pass the stools or feces or loo, whatever we can call it as, the intestines are trained over a period of time not to throw, but to hold. So when they start holding the things, it leads to constipation. There we give the words Vibandha, Vitbandha, Vitsanga, all those things. So the basic knowledge is when you have the urges coming from the body, just address it. So Purisha, so especially the stools and the urinary bladder, and in women, the menstruation. All these things. So we also speak about the menstrual cycles because women tend to pop up some pills and like meddle into the normal activity of the menstrual periods. Why I'm mentioning this is these are all interrelated pelvic organs. So pressure in one can cause pressure on the other. So constipation can produce pressure on the bladder, the uterus, and many more structures in the pelvic cavity initially. So later it can also, the pressure also can build up in the abdomen and the chest, leading to many pressure related symptoms. So the simple thing is when there is a pressure, when there is a call, when there is an urge, just go and address it. So that's very important. Pureeshaja Udavarata is a condition where you are obsessed or you are habituated to hold your reflexes or the urges of natural defecation, disturbing the natural mechanism. Where you are doing that is in the colon, which is the primary seat of Vata. The Vata gets disturbed and moves in a haphazard way, that too in the upward way. And the intestines learn to hold things instead of evacuating the things. Pureeshaja Udavarata. Malasanga is another word used. Shakrat Graha again is another word used for constipation. So many terms situationally, I have missed out certain words intentionally not to magnify the things. So here is to tell that contextually different terms mean constipation in those conditions. It can be a primary condition caused all by itself, like due to regular obsession or habituated constipation, we call it as habituation to hold on the natural urge for defecation, or it can be a secondary presentation of any complicated disease. So don't try to handle your constipation if it is chronic and stubborn just by the home remedies. So when it is chronic and stubborn and not going off easily with any home remedies or simple remedies, there may be a big demon or a dinosaur behind the constipation, immediately consult your doctor and try to find remedies for constipation. It may look like a simple condition, but it can complicate and mess up your life. So having said that, a few points quickly to remember. While going, so constipation is predominantly due to Vata. So there was a question whether there is a Pittaja, Kaphaja, and first of all, there is no Vataja Vibandha at all explained in the text. So Pitta, Kapha, and other doshas can be associated in due course of time. So along with Vata. So like if there is excessive Kapha involvement, so Ashaya Apakarsha is a condition where Pitta is pulled into the colon or Kapha is pulled into the colon. They obstruct and they meddle with the activity of Vata. Mainly among all types of Vata, it is the Apana Vata which is very much involved in the defecation and also the urination, so ejaculation, menstruation, all these activities, it is Apana Vata which is involved. So here we are trying to disturb the Apana Vata mechanism by withholding certain things. So Apana Vata should be balanced in its colon. So we know that colon is a primary seat of Vata. Again, any Vata disturbances, Vata Prakopa. So coming to the Vata Karma, so that is normal functions of Vata. Shukra Artava Shakrut Mutra Garbha Nishkramana Kriyaha. Shukra Artava Shakrut Mutra Garbha Nishkramana Kriyaha. So the normal functions of Vata itself is expelling. These are few functions among many functions. Garbha, so that is normal delivery. Artava, so normal menstruation. Shakrut, normal defecation. This is a point where we need to stress here. Normal defecation, just go into the loo, sit on your pan, easy evacuation, come out. So this is easy evacuation normally is caused by Vata. So if it is not happening properly, definitely the Vata is at mess up. So either individually or associated with its other friends, that is Kapha and Pitta. Shakrut, Mutra, so normal urination, natural urination, and Shukra Tava Shakrut Mutra, Garbha Nishkramana Kriya. Shukra I did not mention, so I mentioned Garbha initially. So Shukra is ejaculation. All these functions are carried out normally by Vata. Mainly Apana Vata is involved. So other Vatas also can be involved, like if there is indigestion as a backdrop of constipation, Samana Vata is involved. If there is a lot of stress behind the constipation, stress-induced constipation, exam-induced constipation, during examination there may be diarrhea or constipation. Here the Prana and Udana Vata are related. So the Prana to the Prana Apana axis, disturbance of the Prana and Apana axis may lead to constipation. Like that, so we can see the role of different variants of Vata in the causation of constipation, but it is always Apana Vata. If other Vatas are not identified, it is Apana Vata which is disturbed and imbalanced and is aggravated during the constipation. So coming to Vata increased symptoms, among the Vata increased symptoms, that is Vata Vriddhi, Shakrut Graha, so that is the word used. Shakrut Graha is withholding of the feces, and in the Vata Prakopa Lakshana, so like Samsavyasa Vedaswapa Sadarukto the Bhedana Sanganga Banga. Sangha is a word used there, which means to tell that things which need to be expelled or withheld in the body. So Shakrut Graha and Sangha are the words used in Vata Vriddhi and Vata Prakopa Lakshanas as well. This shows that Vata increases. So why this happens? Because of the Ruksha Guna and also the Karaguna mainly. So the drying quality and also the rough quality of water. So it dries up the feces excessively. That makes feces like excretion very difficult. So that causes constipation in that context. So going to the mechanism. So here there is a reference. Pakvashayam tu praptasya shloshyamanasya vannina paripinditam pakvasya vayusyat katubhavataha. So in the last stage of the digestion, when the digested food goes to the colon, there the Vata is formed. Pakvashayam tu praptasya. There is a Agni. We have discussed about many Agnis. Here Shoshya Vanni is mentioned in this context. Shoshya means that which dries up, that which sucks all the moisture, water, everything from the feces. A beautiful explanation to explain the mechanism taking place in the colon where the water and the electrolytes, etc., the important essential things for the body are finally absorbed before the body identifies that this is waste and I need to throw it out. So that is the feces. Before its formation, the Shoshyamana Agni or the one acts on the food, the final product of the food, and still whatever nutrients, water, etc. are there, it absorbs. When this mechanisms hypersedes, like when it becomes very aggressive, there is excessive like squeezing of the moisture and the watery content, minimum watery content of the feces as well. The feces get hard, and there it becomes a crura costa, difficult to eliminate, difficult to excrete. So this is the mechanism which happens in the colon, which is the primary center of Vata again. So coming to another condition, Vishnabda Jirna. Vishnabda Jirna, I would mention Vishama Agni. Vishama Agni is a Agni which behaves on the dictation of Vata. Kadachit pachate shamyak, kadachit na pachate. Sometimes the food is properly digested, sometimes it is not. The defecation also is in the same pattern. Sometimes there is like defecation, which is comparably easy, and sometimes it is very hard. So this depends on the Vishamagni as well. So Vishamagni indicates the predominance of Vata in the body, sometimes properly digestion, sometimes improper digestion, the digestion altering pattern when the person complains. So this is typical of Vata in the body. That can cause and put a strong impact on the feces as well. So in the final stages of the digestion. So Vata Prakriti people are more prone. Vata Prakriti people are more prone to get constipation. So that was the related question as Dr. Hebbar rightly posted at the beginning of the discussion. Vata Prakriti, other Prakriti people can also have constipation, but Vata Prakriti people are more prone to constipation. That is why they need to be very much cautious about their foods. So Vata increasing food and lifestyle practices are not good for them. And at the same time, not taking Vata balancing foods also is a problem. So Udavarata, again Vegadharana, so holding the natural urges any times, so that's already discussed. Vata Vikruti, there are some diseases in which Vata is increased, and there are some subtypes in which Vata is increased. Like example, Vataja Kasa, Vataja Jara, Vataja Gulma. In Vata Gulma also there is a specific mention of constipation. So where Vata is predominant in the subtype, or Vata itself is causing a disease, or in the Vata Vyadhis, the constipation may be on the higher side. So here Vata needs to be addressed. So people living in Jangala, Jangalam Vata Bhuishtam, the people living in the Jangala Pradesha, the desert-like conditions, dry conditions, regions, or the geographical areas, they are prone to develop constipation more than the others who are living in Anupa and Sadharana Desha. And as a secondary disease, I discussed already that constipation may be a part of secondary diseases like Vata Gulma, and there are some associated conditions like Atmana, Atopa, and Anaha. So coming to Rutucharya, so the seasonal Grishma Rutu, or the summer, is the season of accumulation of Vata, and Varsha Rutu, so that is the monsoon or the rainy season, is the season of aggravation of Vata. So the Rutucharya, the following the disciplinary methods or the seasonal regimens in Grishma and Varsha Rutu is very, very important. If this is followed in the consecutive Rutu, that is the Sharad Rutu, the Vata naturally specifies. And those who are habituated to take Katu Tikta Kashaya Rasas, so the pungent, the bitter, and also the astringent tastes are very, very provoking Vata to Vata aggravation. So in this condition as well, so people who are habituated to take Katutikta Kashaya Rasas in excess, the spicy foods, the bitter foods, the astringent foods, they are also prone for this condition, that is constipation. So, and coming to Avarna, I have touched upon this particular point again, how different Vatas can influence the colon and cause constipation. Muladhara Chakra imbalance is also said to be an important aspect. Muladhara Chakra imbalance. So this is again a big topic I don't want to touch here. So that is the root chakra, the cycle chakra, root chakra, which we call it as, located at near our tailbone. So that is related to our childhood insecurities. So here I would like to point one particular thing, that people who are visiting a doctor and have a lot of childhood problems, especially the early childhood problems, where the father or the mother or somebody or the teacher or somebody was dictating their lives, they don't know what to do. They have developed a lot of insecurities. So those insecurities, it is said that they're saved as negative energies in the Muladhara. So that is in the Muladhara Chakra. So when that happens, the person has difficulty in defecation, urination, ejaculation, menstruation, all these activities. Sometimes we feel, in spite of giving all the medicines, all the treatments, why we are not able to address constipation. This is all about the negative energies held up in the Muladhara Chakra. So that is a high science. So, and then the relationship of Agni Ajirana, and Ama, we have already touched upon. So coming to the modern days, the seating postures, the continuous use of gadgets, junk foods, not being choosy about good foods, not focusing on the time of food, and there may be a lot of other things. Very importantly, we give most priority to other works, and during that particular time when we have the defecation reflex, we don't address it. When we make a habit of that, your colon starts giving up, and when it starts giving up, the vata starts getting imbalanced, and vata imbalance, we know, can imbalance every aspect of your health and the body system. So this is a small, so there are many points. So this is a small introduction of how the constipation can occur, and what are the factors contributing to the causation of constipation, without touching on its remedies. Over to you, Herbasa. Thank you.
Thank you, sir. Now, let me invite Gurubodha sir to this discussion. Gurubodha sir, clinically, when you come across constipation, what are the things that you would consider in a patient? And also, I would like to touch upon few home remedies or lifestyle advice that you advise along with the medicines for a patient with constipation.
Continuation with what Dr. Raghuram has said, has touched upon a lot of areas of constipation and the whole sort of data. There are important aspects that Samanavata is the one which is responsible for the separation of Kitta and Malabhaga and Sarabhaga, these type of combinations. So Sarakitta Vibhajana is done by Samanavata, and later it pushes down the material. So when it pushes down the material, that has to be into the area of Apanavata. Then Apanavata has to allow it to go out easily. So then creates a normal pressure, and if it is everything fine, then it goes out. But presently what happens is, many times because of the age factor, because of the co-medication what they are taking, some antibiotics or something like that, or some other drugs, or they are not consuming the proper water or liquid contents, consuming a lot of dry materials, ruksha ahara, something like siridhanyas and so many things. So when these things are done, and there is always having a habituated to work in a sitting posture for long hours, stopping the urges or postponing the urges, definitely all these factors leading to constipation. One of the interesting factors is that people think that consuming raw vegetables or consuming more fiber-rich vegetables, and this is good and it is going to be relieving the constipation. But Acharya Bhamishra says Shakha is constipative. It causes constipation. So that's a very important thing that we need to understand. Moreover, sneha should be there in the food what we consume. If it is because of the diet conscious or because of the obesity or prevailing lipid issues and so many things, if proper gridhabhyasa or dugdhabhyasa is not done daily, then definitely they will land up in constipation. But the basic problem is nowadays, generally, constipation we used to have come across in olden age, but presently situation is not like that. Even the childhood constipation is also reporting. There are many cases where and this is severe constipated. Even a very small child, even a few months old child is also causing, developing this type of constipation. And nowadays we are using a lot of medication. Home remedies we give sometimes the soaked, even the senna leaves to some extent, and then Trifla churna, something like that, or Haritaki churna with Guda. So many times all these combinations. But thing is, somewhere we are missing that important activity, that is Vata has to go in its direction. Apanugataha. It has to move in the downward direction. Due to our habits and our functions, we are trying to make it move in a Udavarata direction, missing the line. So definitely that is one of the important reason for holding back. And when the stools remain in the colon for a longer duration, automatically it becomes more and more dry because of the reabsorption of the water from that. And people having fecolics, it is so hard, just like a stone. So in that condition, it is very difficult to expel it out and causes a lot of trouble. And when they try to push out these constipated stools, that hemorrhoids, and if you do it in a very with the pressure, sometimes it may cause straight away fissure. So these are all associated with this constipation. And one of the company produces one important product, and from that product, the company is surviving since so many years because they are famous for that combination. The combination is being used by many people, which itself suggests that the constipation is a rampant issue nowadays because of the food, the type of food what we're using, the way we are living and taking less liquids, and we are not habituated to take the oils and fats which is required as per the norms. So many factors, and we are eating a lot of pungent items. So not only these, even constipation can occur even in the old age. And the old age constipation may be sometimes associated with certain diseases also, where there is a nerve related issues connecting to the colon, like paralytic ileus or a little bit of Parkinsonism, and such type of condition can also lead to constipation. And these things need to be taken care with the help of either laxatives or to a mild purgatives, and by giving Matra Basti or something like this, or trying to change the way we live, improving the fluid conditions and our hydration to the body. All these things, if it is taken care, then automatically the constipation can be avoided. But one of the important issue associated with this constipation is in those patients, those who suffer from constipation, in a due course of time, they develop amlapitta, urdhvaga amlapitta, or they turn up into a very severe form of acidity, that is GERD, gastroreflexive esophageal reflexive disease. And their suffering will be like anything, it is be hell. Many times they will come with varied symptoms of catch somewhere in the body, somewhere in the back, and even the headache, vibrations. They are not unable, not able to stand up properly. So many issues they come out with that, and even a mucus in the throat, something like that. So many such various symptoms are also there, and it will be long lasting in many conditions, and patient will be definitely in a very bad state of affairs. So we need to handle those situations with use of Vata Hara Dravyas, basically Snigdhatva, and we need to bring in Chalatva of the Vata and try to move it in the proper direction. If these things can be achieved, and definitely the things will get better and better.
Thank you, sir. And now let me bring in Dr. Ashish Rawat. I have heard many stories from the US that it is not considered as a healthy sign. Like in Ayurveda, Malatyaga, Shauchakarma, etc., have been explained as something to be done on a daily basis. But defecation process is not considered as something to be done normally on a daily basis, or it is okay to defecate a few times in a week is sufficient. That notion is prevalent. Is there any truth behind that, or what you do as a teacher of Ayurveda in terms of patient education in such notions?
Yeah, thank you. Thank you for asking this question. Coming to the US aspect of why people have this notion, it's I would suggest the self-health, little illiteracy. You could consider that maybe that can cause us. It's not necessary that everybody thinks that way. But with that, I would like to mention another point, which is, I think, very, very important, which maybe we are forgetting, that not always that you go every day means also you're not constipated. Sometimes constipation can be, in my practice, what I have seen, constipation can be of two types. One is, of course, not having the bowel movement every day. That could be obviously straightforward constipation. And then the second point could be that even if you're defecating, you're not completely emptying out the bowel. So the rectum is defecating some amount, but it is not completely evacuated. And that is incomplete evacuation can also be considered as constipation. And so how do you know about this? Like, what are the clinical signs, what you could see for? There are many clinical signs, of course, as we always know in Ayurveda, that we go for checking tongue. We do see the pulse. We ask patient that how do you feel when you get up in the morning? Do you feel fresh, or do you still feel sleepy? You are not that much active. And there could be some other signs also, as Dr. Gurubodha ji mentioned, that Amalpitta happens, GERD comes, and headaches, and all these other things could happen. But what would how the patient could know that, right? How a patient or a client can find out whether he or she is completely evacuating. So I generally give in my practice one simple test for patient to do that. So what I generally would recommend that, eat spinach or the beetroot, right? And then next day, just observe if you see some green or that, beetroot's red color into your bowel, and maybe check it even the day after. Sometime it would be observed that next day it doesn't just come, though patient go for the defecation, still that color doesn't come, and then the day after that it shows up, which indicates that you are not really defecating the eaten food, which is supposed to be the previous day food, supposed to be like samana should be absolutely doing the sarakitta vibhajana, and then apana should be excreting that completely. That may not be necessarily happening, and that is also could be sign of incomplete evacuation. So these, major points we could educate people with, that not necessarily always that you are defecating means you are completely evacuating your bowel. It could be defecation could happen. That's why in Ayurveda we have given so much importance to how even the mala looks like, right? The importance are given, or not just the appearance of mala, but how the function tastes are given, that whether the mala sinks in or it floats under the water or it floats above the water, or what exactly it is appearing. That makes it extremely important to know that the defecation is proper or the mala is proper and it's really not constipated, and the presence of ama is there or it is not there. All these signs could actually help a patient to become more aware of the self-health. And obviously, as you know, constipation could be a very, it could be a cause for many other diseases. So the real health is really having a complete bowel movement. Thank you. Back to you, Dr. Hepar.
Thank you, Dr. Ashesha Rawji. And yeah, it is like incomplete evacuation is such a big problem that the patient may be going every day or multiple times in a day also. We can see the patient's pain and agony of incomplete evacuation. He just wants to get rid of that. Guru, sir, your points.
One important point said in Ayurveda is, according to Yoga Ratnakara, a person is defecating 2 times a day. That is called as Dve Purushe Shan Mutre. 6 times urination and 2 times defecation is said to be Swastha. So any person who is Swastha at least should defecate 2 times a day and 6 times urinate. This is what one reference we could get in Yoga Ratnakara.
Thank you. And moving on to some of the questions that have come. Constipation associated with bloating and also dry stools. What is the connection and how to analyze that? Raghuram sir, can you please take this?
Right in my intro of constipation itself, I said, so the bloating, the distension of abdomen, everything is related to Vata. So there are the Vata related conditions. Obviously, when there is constipation, so things indicate that there is a Vata increase. So Vata increase may cause constipation, but a chronic constipation is always a reflector or an indicator of Vata increase in the system. So once that happens, there is Udavarata. The normal functioning of Vata or the Apana Vata has, we have changed the coding of that particular Vata. Vata understands in a different way and behaves in a different way. So this is people who are obsessed with withholding the defecation reflex. So in that particular instance, so when there is constipation and constipation is running for months and years together, so it can cause the reverse or the retrograde movement of Vata that can open up the like the entire picture for Admana, Atopa and Anaha to manifest. Already we were discussing about the bloating is a word which is covered under Udavarta, Admana, Atopa, Anaha, all these conditions, which are basically caused by the imbalance of Vata. and particularly of Apana Vata in the system. So if we see through the Ayurvedic system, so this is Ayurvedic explanation, this is what it exactly happens. So withholding the natural urge for defecation, continuous process, Vata gets aggravated, Udavarta, giving a foundation for many disorders like Atmana, Atopa, and Anaha, which also includes bloating. Seen from a modern perspective, many things may not get converted properly in the intestine. Paripinditam patpasya vayusyat katuvavataha. So the paripinditatva, so that is the excessive hardening of the feces takes place, excessive vata is formed, and a lot of other chemical reactions may take place because of the withholding of the feces inside. A lot of gases, toxic gases which are not required for the body are also formed. They start giving pressure symptoms leading to bloating and a lot more conditions. Another condition Gurubodha sir rightly mentioned, so this may pave the pathway for many conditions like GERD and other conditions. So when there is obstruction and also the blockage in the lower parts, it obviously puts pressure in the upward direction, and it can, so GERD, all those things reflecting that the imbalance has reached to the level of the stomach and the small intestine. So there may be a pressure on the chest, there may be a pressure on the head and neck as well. So when we see through the Pureeshaja Udavarata symptoms, so we may see wide range of symptoms covering almost entire body. So when we see this, bloating is a mechanism which is associated with the constipation. Even from the Ayurvedic lens, all these are related conditions. Udavarta, Admana, Atopa, Anaha, all these things connected to the Vata increase, and what cause is causing that, so that needs to be identified. Sankshepata Kriya Yoga Nidana Parivarjanam. So stop keeping away the positive factors and address Vata and give suitable remedies. So when constipation and Vata are controlled, bloating also naturally comes down, and it will be an answer for treating GERD and other conditions caused due to constipation. This is the secondary manifestations. Over to you, sir.
Thank you, sir. Gurubodha sir, please.
See, question seems to be a little bit varied because the observation is not right. Constipation seems to happen with bloating and also dry stools. No, it is not like that. Constipation happens first, which results in dry stools as well as bloating. So that is a simultaneously happening process, and the bloating takes place behind the area where the constipation has occurred, because the stool which is going on putrefaction producing a lot of gases, and that gases, instead of going outward in the form of a fart, it is trying to move upward, and that is causing constipated, and that is called bloating. So it is from the constipation the bloating takes place. It's not from the bloating the constipation takes place. It's not like that. The dry stool, the formation of dry stool resulting in constipation is the first step. From that, bloating occurs as a secondary one. Then it results in Udavarta, and later it goes to Atopa, Admana, then Amlapitta, then Urdhva Amlapitta, like that. It is from the Apana is trying to move towards Prana. That is the thing which happens in these conditions.
Thank you, sir. And moving on to the next question. Is constipation associated with pregnancy? You know, month after month, increased occupation of the abdominal cavity, the womb puts a natural pressure on the intestines, especially large intestine, leading to constipation. So, question to Asha Rawatji is how to handle this, and also I have seen a phenomenon these days that women become sedentary, and lack of movement and lack of physical activity also plays a big role in this, like pregnancy related, they become extra cautious.
Yes, absolutely. You perfectly said that, and days nowadays we are seeing this so much pregnancy and constipation kind of really becoming very much prevalent now. First of all, that is true that because the uterus is growing, fetus is growing, and uterus is growing, and that creates pressure on the, as it starts growing more and more, automatically the abdominal cavity is being taken away by the uterus only, and so the freely movement which is supposed to be happening doesn't happen. That much is okay, but more becoming because the pregnancy, and if pregnancy with some other complications, then the pregnant lady has to take the complete rest, and there this newly added responsibility would create newly problem creating, not just the pregnancy as a problem, but pregnancy other complication that definitely restricts the patient's movement, and then that's the one aspect. Then the second aspect is many time people with on the names of, Daurudhini, means like, okay, I'm pregnant, so I want to eat this and I want to that kind of thing also happens. And during that period, whatever that lady feels to eat is being given. I'm not saying don't give that way, but this is actually a very crucial period where you really should not be eating much of fast food. And as you know, fast food would have more of a, like, less fiber, or really a very not really the way it could have certain overly processed food which can stick into the intestine, and that also causes the constipation. So becoming very aware that one has to eat nice food, that is another very, very important part. Then the third part which I see in my practice is people become more aware that I want to eat more protein because now the baby is also growing. And this could be really another challenge, because when you eat purely protein, and that to animal protein, in any form of animal protein, maybe it is meat or whatever, that further creates constipation, because any meat, whenever it is eaten, it takes much more time to be digested compared to any other food. So that becomes another third or fourth very important issue, and people have to be, the pregnant lady has to be very, very educated nicely, and definitely has to be said that, eating really supacha, whatever is mentioned in Ayurveda, something food which is easily digestible, but it should be with all the 6 tastes and with all the aspect of the balanced food, what we believe that is absolutely necessary. I would like to quote here that Acharya Charka also mentions that if you eat one specific taste too much, then what happens into the body, that is also been mentioned there. And that's why really eating proper food is very, very important. Now, coming to the treatment aspect, very first treatment is that lady who is pregnant should walk. That is absolutely true. Then should eat balance, which I have already said, balanced food. And then if something comes, then you can still have, in your diet, can have more fruits, or even as simple as grutam, adding the grutam in the food, ghee or gruta would also help, rather than taking any, because all these laxatives are absolutely not recommended during the pregnancy, so that should be absolutely avoided. What another simple thing one can do is, as it has been mentioned already, that the raisins, black raisins, or the manuka, what we call, or the draksha, black drakshas, are the best treatment. One can easily have that can help to nicely, bring the bowels in the nice form. Or else is maybe in drinking little more water to make sure that you're well hydrated, because with the pregnancy your fluid intake has to go little up, because you're completely developing a fetus. That takes another toll on the body. So keeping yourself hydrated would be also very, very important aspect. Thank you.
Thank you for covering all the important aspects. Generally, yeah, like in previous generation, maybe it was quite common for the doctor to advise his patients to eat more during pregnancy. You need to gain weight, etc. Now we have like a reverse problem, like problem of overabundance, like extra care given to the patient by the family members, and also we need to educate them to like healthy and eat in appropriate quantities rather than excess. Raghuram sir, please.
I would like to compliment what Dr. Rawat said, and also really appreciate her expertise points which she has covered very quickly, what it means to avoid constipation during pregnancy, and how pregnant women should be given the awareness of constipation and how to care about that. Here, an interesting fact to note is Ayurveda has in detail explained about the Masanumasika, Garbhini, Paricharya. So that is month-wise taking care of the pregnant woman, what she should do and what not. in terms of most of the points related there are related to the diet itself. If we can see through the blueprint of the protocol of the Masanumasika, Garbhini, Paricharya, it is very clear till 7th month, whatever foods have been given consists of milk, ghee, meat soup, butter, and lot more things which can control Vata naturally. So we can see that Ayurveda has not explained any laxatives or purgatives directly during these 7 months, what to do when pregnancy is associated with constipation, of course, when it is associated. And even Anupasamskruta Shira has been mentioned in the initial months, like milk should be given without processing them with medicines. Here the alert was, don't use any medicine which you don't know, herbs or formulations which you don't know how it would affect on the pregnancy of the woman and also the fetus, Anupasamskruta. And later, I think Sushruta tells that Upaskruta, some Kshira also can be given, provided if there are some problems, small quantity can be given in the day and the night. So such precautions were taken during this particular time period of the pregnancy. And the first 7 months, if you go through the diet protocol, will be shocked and stunned to see that basically the food consisted of the Tridosha balancing food, mainly targeting towards the Vata balance, and because the Vata is associated with the maintenance of the pregnancy and also the Garbhanishkramana Kriya. So that is the delivery. Safe delivery at the end of the pregnancy period. So that, and only in the 8th and 9th month is Anuvasana Vasti and Kashaya Vasti have been mentioned in that particular period. And in the 9th month, so going to the term of the pregnancy, only Anuvasana Vasti, so that is the oil or the ghee enemas have been mentioned. If to control Vata, to balance Vata, to prepare the uterus to expel the fetus or to push out the fetus in an easy way. So that is training Vata and also training that is the location where the fetus is being developed. So to put it under training so that the soft delivery takes place, these treatments are brought later. And also it gives an idea that towards the term of the pregnancy, end term of the pregnancy, 8th, 9th months, there may be some constipation related issues in the woman that also will be addressed when Anuvasana Vasti and the Basti therapies which have been mentioned are administered. So here, one following the regimen of it looks like it's difficult and it looks like it's easy also to follow this regimen. So, but reading through that, it gives a lot of ideas on what basis these dietetic protocols and the treatments towards the end of the pregnancy were made.
Definitely, during pregnancy, the important thing which results in the constipation is the growing fetus accommodating the available space in the pelvic cavity as well as in the abdomen, thereby pushing these colon and things to a sideline. Automatically, it hampers the natural peristaltic movement in the gut. So that results in constipation. Probably knowing these things, Acharyas have very clearly mentioned that what should be given to the women in the second trimester and first trimester and everything they have mentioned. There's a reason, even with all these things, still in the third trimester, there will be some sort of constipation. To overcome that constipation, Acharyas have very clearly mentioned use of Matra Basti, because Matra Basti is very simple and it can be used at any time. There is no such hard and fast rule and some recommendation or restrictions. So it can be easily handled and easily used by anybody. And this regular use of Matra Basti during this period will not only help to come out with the constipation, as well as it try to maintain the Garbhanishkramana Kriya, keep the other orifice open to next the expected protocol or the action which has to be taken as a delivery. So that portion has also been supported. So that yields in easy delivery of the child. So that will happen if these particularly Matra Basti concept has to be introduced in the third trimester of the pregnancy.
So what would be the ideal Snehadravya for this, and what would you suggest the dose of?
Usually 25 to 30 ml is sufficient.
And ideal Sneha, if you can suggest this.
The basic Sneha which we do as a practice is Kshirabala Taila. This is the most convenient and most easily acceptable.
Thank you, Doshas. And to your point, the Bala has been explained in various stages as ideal drug in Masanumasika, Paricharya also a good choice there. And
yeah, so adding to Gurubodha's additions, so Dhanvantara Vrita and Madhanvantara Vrita, so these have been like mentioned. So as for maintaining a pregnancy and also for taking care of the development of the child within the womb, that can be given. So Dhanvantara Taila also for Abhyanga has been mentioned during the early trimesters of the pregnancy. Dhanvantara Taila and Chirabala Taila, as mentioned by Guruji sir, can also be used.
Thank you, sir. Ashasha ma'am, please.
Yeah, so absolutely, these are the excellent Gruta Tailas. But if nothing is there, at least giving Tila Taila would also work. And I also remember during my gynec residency, we used to always, whenever the patient would come, absolutely used to give her Niruha Basti. And that is the only time when we give Niruha Basti, because now the labor is being started. So that is also, instead of giving simple slow porter enema, giving actually Niruha Basti of the Shmula Kashaya, or even the Eranda Sneha was added into that, and then the Basti used to be given. That also would work wonder. Like very ease delivery would happen. So just was remembering that. Thank you.
Thank you, Dr. Ashasha. Raghuram sir, please.
I think, Hebar sir, I think I misspelled there. Mahadhanvantram Gulika, if you can add up instead of Dhanvantram Guta. I think it is called as Garbharakshini Gulika or something. So if I'm not wrong, so that's that is the best one during the pregnancy. It has been said Garbharakshini Gulika, something it is named as according to the Keralian practices. So I misspelled Gulika as Gruta there. So that can be given. So and Dhanvantram Taila, yes, for extreme users. Thank you.
Thank you. And there's a question on like herbs can be given for pregnant women on each month. This is covered in that Masanumasika Garbhacharya, and we have written here. Yeah, just before we end, I just want to include Dr. Madhavbaug sir's inputs which came via WhatsApp. It said that 1 gram of stool contains 5 million microorganisms. Poop metamorphosis and Pureeshaja Udavarata play a definite role. Water reabsorption and chemical activity is dependent on gut microbiota. Improving metabolism, correct food and lifestyle, which was stressed upon by many esteemed guests here. Gruta, Takra, Vyayama, disease pathology, drugs, Rutu Rasayana, Nityakshira, Grutabhyasa, etc. can make some guidelines. Annually, some Shodhana. Probably this we did not touch, but Ritucharya and the Shodhana as per the Rutu plays a huge role. And nowadays in the US it has become quite common that fall cleanse and fall detox, and summer detox and spring detox has been a great way of attracting common public into Ayurvedic realm. Even in many parts of many institutes here also do like Vamana Vasanta. All those things can be done even at like clinic level, so as to increase the footfall, to increase the public awareness, and also to impart the benefits of Ayurveda to the common public. So this becomes a annual Samshodhana Karma. Nitya Abhyanga, good sleep pattern, nutrition will also help in geriatric constipation care program. All in all, a good way to end is probably Madhavbaug sir's narration that like we and some Ayurveda doctors think about like as soon as we have constipation, we think about like Trivulklaya, this, that, medicine, rather than that looking at the patient as a whole and fixing the Dinacharya part and the Ritucharya part, the diet and lifestyle and nutrition would be a better approach, and we can make the patients less reliant, less dependent on the concept. Like Guru mentioned, there are like entire companies built on 1 or 2 products based on constipation. So from there, relying on medicines should be, medicine should be secondary choice and primary choice should be the diet and lifestyle. Really, that's a good point to end this session. I thank Dr. Gurubodha sir, Dr. Raghuram sir, and Dr. Ashasha Madamji for spending time with us and guiding in this important topic on constipation. Thank you, sir and madam. I also extend my words of gratitude to all the participants and sending the questions. Thank you all. Namaste.